Nearly 1.7 billion episodes of childhood diarrheal disease occur worldwide each year. Diarrhea is the third leading cause of death in children under 5, responsible for approximately 4,43,832 deaths annually. Despite being preventable and treatable, diarrhea remains a silent killer, especially in rural areas where the access to healthcare is limited. Only about 20% of diarrhea cases are caused by bacteria requiring antibiotics. The remaining 80% are viral and non-bacterial and do not benefit from antibiotics. However, doctors often prescribe antibiotics due to the lack of diagnostic facilities, especially in rural areas. Overprescription of antibiotics is fueling a global health crisis. Antimicrobial resistance. In India, 9,87,000 deaths were associated with AMR in year 2021, with 2,67,000 directly attributable to drug-resistant infections. Globally, AMR was linked to 4.71 million deaths in year 2021, and projections warn of 10 million AMR-related deaths annually by year 2050.
I am Manish Kumar Swain, the founder of BabyCue Private Limited, with a background of M.Pharm in clinical practice and over 7 years of experience in medical device field. I witnessed the helplessness of mothers and caregivers when children suffered repeated episodes of diarrhea and how doctors with limited options usually prescribe antibiotics to avoid any risk. This motivated us to develop DiaCue, a diagnostic tool for detection of bacterial childhood diarrhea, and help to prevent unnecessary use of antibiotics. DiaCue provides results within 20 minutes. It requires no electricity and no special training to perform the test. There is also no need to wait for days to receive lab results. It is a simple test accessible to everyone. With DiaCue, families no longer have to rely on guesswork, and health workers can avoid prescribing antibiotics without any confirmation test.
Behind DiaCue is a team that believes villages deserve the best of science. From laboratories to workshops, every test strip, every instruction guide, every kit has been built with care. Our journey has involved extensive lab research and hospital testing, with a significant contribution from the KIT TBI Bhubaneswar, Odisha, and Department of Medical Devices, Naipur, Hyderabad, which has been instrumental in our research and development efforts. Supported by partners and institutions, our mission has been simple: to transform research into a tool that saves lives in the most remote corners of India. DiaCue is simple and built for the realities of rural communities. Step 1. Collect a small stool sample with the swab. Step 2. Mix it in the buffer tube. Step 3. Add a few drops to the test strip. Step 4. Wait just minutes. The result is clear. 3 lines means bacterial infection. 2 lines means non-bacterial infection. 1 line means there is no infection. That's it. Answers made simple in the time a mother waits in the clinic. When frontline workers in villages have access to DiaCue, everything changes. Children get the right care faster, families avoid unnecessary medicine and costly trips to distant hospitals, communities become stronger, healthier, and more resilient. DiaCue is designed to scale across India's villages. One short training is enough for any health worker. Clear pictorial guides and affordable pricing makes it practical for even the most remote communities. Our vision is to bring DiaCue into hundreds of thousands of village clinics, protecting children while preserving the power of antibiotics for the future. DiaCue is more than a test. It is a promise to our villages, a promise that parents will no longer have to choose in fear, that antibiotics will be protected for tomorrow, that children will have a chance to live, grow, and dream. DiaCue. Detect early, protect always.